We had a symposium today on small cell carcinoma of the ovary hypercalcemic type. It was an international symposium of all people around the world who studies this disease. It's a cancer that's very, very rare, and it affects young women and young adults, and it's very aggressive. And a number of years ago, myself and a few other groups discovered the gene that causes the cancer. It's a gene called SCCOHT, and we're now developing some therapeutic options to help treat this cancer, which is otherwise quite difficult to treat. So right now we've had some good success with immunotherapy. We have a number of patients who've responded very nicely to immunotherapy, and we're trying to work out the mechanisms by which immunotherapy works in these particular cancers. Most immunotherapy works in cancers that have a lot of mutations or DNA mutations. In this particular cancer, there's only one mutation in one gene, so it's called a monogenic disorder, and that's unusual for immunotherapy to work, and so we're trying to figure out why that actually happens. Other treatments that are being worked on are treatments that affect the cell cycle, and some folks from McGill presented some very interesting data on using palbociclib, which is a CDK4/6 inhibitor. Other people are working on epigenetic regulators to treat this cancer. Yeah, so we're using the standard immunotherapies, pembrolizumab, nivolumab. We're also trying to get a clinical trial working, and we're going to be talking to multiple companies because Merck and BMS have not decided to support this trial because it's a very rare tumor, and it's always hard to do rare tumor research because you never can really say ahead of time that we're absolutely going to get, hundreds of patients on the study when there's only hundreds of patients around the world who get this very rare cancer. So we're trying to develop a phase 2 trial to study immunotherapy in this disease. We're trying to figure out what part of the immune system is really accounting for this type of response. We're also working on the epidemiology, trying to figure out what the actual incidence is, developing patient registries, and also a very important part of the disease is that a fraction of the cancers can be inherited, and so probably 10 to 40% of the cancers can be inherited, obviously from parents, and so genetic counseling and genetic testing is a very important part of treating the cancers.